Hi, I'm Stacey. Joining me today is Steve Civitelli, Director of Public Health Department here in Wallingford. Steve, thank you so much for being here today.
Thank you for having me. I appreciate it.
Oh, you're welcome. So why don't we just talk a little bit of a brief overview of your department and what you guys do for the community.
So we have a lot going on right now.
Okay.
We kind of look at our department in three facets. We have our environmental health section, we have our health education staff, and then we have our public health preparedness section.
Okay.
We could talk quickly about what we're doing in terms of inspections. Our environmental staff inspect all the restaurants in town, food service facilities. We have roughly 289 facilities here in town as of right now. We inspect public pools, daycare facilities, and we get involved with on-site septic inspections as well.
Okay. And you guys also do hotel pools that are in town and things like that as well?
Correct, yeah. Okay. Well, we license and inspect the hotel pools and any other public pools in town.
Okay. And then as far as inspections and licensing for restaurants, do you guys do anything with the food service licensing?
Yeah, so they license once a year annually,
okay.
And part of that, based on their menu and what they're classified as, we actually will develop an inspection schedule.
Okay.
So we have different classifications for food service establishments. We have class 1, 2, 3, and 4.
Right.
And that depends, that shows how many times a year you're inspected. Class 4, you're inspected 4 times a year. Class 1, you're inspected once a year.
Okay.
And that's based on the complexity of a menu. A facility like a Chili's that has a lot of food service operations going on, more of a complex menu would be 4 times a year, as opposed to a church kitchen that's used moderately, if at all, is typically used once a year.
Okay. And then now for the food service management certificates, do you do anything with that for the people that are actually working there? I know they have to have at least like one person on staff that is certified.
Correct. So actually in the state code they talk about a class 3 and 4 establishments are required to have one qualified food operator in the establishment. So there's typically a private entity that offers those classes, and we felt that we could offer that course at cost, save the operator some money, and at the same time build that relationship with the facility in town. And then this way it provides us a gateway to kind of have discussions for other things about what's going on in the facility as well.
Right.
And we usually offer that quarterly to the food service facilities here in town, and we've pretty much filled up every class we've done over the last several years.
That's fantastic.
Yeah, it's
and
very
it builds
nice.
a rapport. That's nice that you guys actually get a little bit of a personal relationship together. At that point.
I agree. So we have the enforcement arm of the health department, but we also have the educational side, and when we do food service inspections, you kind of need to bring both into it. Yes, this is what we're looking for, and this is how we're expecting you to respond if something's incorrect in the inspection. And when you have an understanding from where we're looking at things as a certified manager, it kind of helps the operation flow better.
Absolutely. Yeah. In addition to licensing and things, I know you guys also help with daycares and individuals with lead poisoning and checking on those things as well. So
we also have, we inspect daycares, and as well as the state does, but we do what's an environmental inspection, which takes a look at the food that's served at the facility, any types of chemicals that are being held on site, any of the paperwork they have for allergens that are for any of the people that are going there. And then regarding lead, we are required by statute to any children under the age of 6 that are impacted by lead dust or lead paint, we're required to do an epidemiological inspection. Okay. And we do an overview as to how that's impacting the child, whether it's in the home or some other method that's actually impacting that child. Right. What we do offer at the health department are preventative risk assessments to landlords and to tenants, where we would actually come in to a house that was built prior to 1978. We assume that there's lead paint. Right. And then based on that, if somebody is moving into a house here in town or a tenant, we would actually go out and do a risk assessment visually to say, hey, there's a very good chance that based on what we're seeing here, it's showing signs of lead paint. Okay. And things that you could do to reduce the impact to your child. Right, and you guys do like dust wiping and things like that in order to check for the lead and all that? That is correct, yeah. So prevention's a big thing for us. While we can handle something after it's happened, we prefer to prevent anything from happening at all. Absolutely. And that's the concept there. And for daycares, do they get inspected for lead, or it's just if there's a
child that's reported with lead, you guys would go in at that point?
So the daycare facility, the facility which houses the children is built prior to 1978, they're required to have a lead management plan.
Yep.
So it's already been tested for lead, and if there's any, they have to have a management plan on file, and that's something that we monitor when we do our inspections as well.
Perfect. Now that we've talked about what you guys do as far as your environmental and health functions, why don't we talk a little bit about the Community Health Alliance?
Okay.
I know it used to have a different name, and now it's a new name because it's 2020 already.
Correct.
Why don't we talk a little bit about what it is and what they do?
So we had Healthy People 2020, Healthy Wallingford 2020, and then we started 2018, we started coming up on 2020, and
right.
we're thinking we should probably call this something else that encompasses not so much the year, but our mission.
Right.
And so we came up with the Wallingford Community Health Alliance, which
right.
basically is a group of individuals, nonprofit municipal entities that are working together for a healthier Wallingford.
Right.
And in that plan, we actually have different focus areas that will basically try to help improve the health and wellness of the community.
Right, and I know there's 4 like major focus areas: healthy housing, behavioral health, healthy lifestyles, and then Eat, Play, Unplug. Why don't we touch a little bit on some of those?
So the behavioral health one is something that we've been looking at a lot this past year,
right.
as well as there's a section that talks about substance abuse as well. So we've been looking into opioid abuse. Vaping was something
right.
that we dealt with a lot in this past year when the town raised developed the local ordinance to raise the age for purchasing
right.
tobacco products from 18 to 21. That was all part of the larger plan, and to try and have an impact to the community. And public policy has a big impact on change.
Right, and we were one of the first out of so many towns to actually get that increase.
Correct.
Right.
Yeah, we were one of the first ones. And I think ultimately many of the towns developing their own local ordinances led to the state changing it.
Right. I think that's amazing.
Yeah.
Absolutely. In Eat, Play, Unplug, I know that we're trying to get families to get off of your electronics and actually do things outside and just try and be involved in your family and not just sit around and watch TV and look at your tablets.
How we function as a society has changed, and I think that sometimes there's good change and sometimes there's change that we should just identify some of the problems with it and try and see how we could improve our quality of life, and that was what Eat, Play, Unplug was about.
Right.
You know, eating properly, trying to get outside and get exercise. Don't forget about the exercise. That has so many impacts on your well-being, and unplugging with social media and all the other facets that are available through technology now. We wanted to stress the fact that, you know, unplugging, de-stressing is a big part of what we're seeing now is impacting people.
Right.
So to be a healthier person, if you're eating right, maybe you put the phone down. Right. I find myself on my phone sometimes and
absolutely
thinking I need to put this down now.
Everybody does it, but try and, like, you know, put it down once in a while.
Put it down
especially
once in a while.
for young children, because if you're with your child and I know you want to get things done around the house or whatever, giving them a tablet or putting them in front of a screen for hours on hours of day is not beneficial to their minds.
Correct. And if they see the adult using it as well frequently,
right.
then that also sets the pattern for how they're going to behave.
Oh, yeah.
So the model behavior as well is something that we're talking about as well. We're going to be offering a 3-week basically Eat, Play, Unplug course that's going to be in the Park and Rec brochure coming in the spring.
Okay.
And each section is going to be highlighted, and we're going to have someone come in as a dietitian to talk about the eating correctly, how to de-stress, and we're going to go through each section of that.
Oh, that's awesome.
Something that we're going to be offering soon.
Something
And
to
we're
look
excited
forward
about
to.
that. Yeah.
Check out the brochure.
Yep.
Absolutely. And then Choose Kindness. I know that when I had your employee Alexis here, she was really wanted to focus on Choose Kindness because it's just, you don't see it as much anymore. And here in Wallingford, I do notice that there are a lot of people that will hold doors for you and just simple things like that. But I think choosing kindness is very important. It brings the community together.
Correct.
So why don't we talk a little bit about what people can do just to help Wallingford grow and be kind.
Wallingford's a great community, and
right.
people tend to respond to department efforts when we're looking to do things, and something as simple as just being kind to a person, treat others the way you want to be treated. Right. There was a little bit of discussion around social media and some of the negativity that comes with it, and I think in turn then turned the Choose Kindness campaign somewhat started. Mm-hmm. And last year at Celebrate Wallingford, they did the Kindness Rocks.
Yes.
And that went over very well. And right. then this year we did pumpkins, and we had over 700 pumpkins basically be done at our booth. And
right, at
really
the town hall, right?
Town hall.
Yeah,
and really the
awesome.
intent behind that is as you have so many parents and families coming together as they're painting that pumpkin, they're talking.
Yes.
And then they're talking to us about town services, and we're showing them some of the things that we're doing. So at the end of the day, it's a win-win for everybody.
Right. And I think that the more that adults choose kindness and show their children how to be kind, it lowers bullying levels in school. It teaches them to be kind to someone that might be a little different in your classroom and things like that. So I think that parents really need to do that so that their kids can see it.
The community is what you make it, and
Absolutely.
That's kind of what we've been saying all along, is that when you're kind to somebody, they in turn respond,
right.
and ultimately small things could make somebody's day.
Absolutely.
And I think that that's so true.
Right. Well, we have about 2 minutes left, so why don't we talk a little bit about public health preparedness.
Okay.
And I know that there's a volunteer group that you guys are working on. Why don't we talk a little bit about the Medical Reserve Corps?
So we have the Medical Reserve Corps, MRC. It's a little bit of a misnomer in the name, it's medical and non-medical volunteers, but ultimately in a large-scale town-wide disaster type event,
Right.
whether it's mass sheltering or mass dispensing of medications in an influenza outbreak, we need volunteers to help us. So we've recruited over the last several years 154 medical and non-medical volunteers to help us with that. We offer trainings like CPR, first aid, active shooter trainings, until help arrive trainings, just to prepare these folks for something that they may see.
Right.
So we're trying to build a resilient community.
Right. So if people are interested in volunteering for that, they should reach out to your department?
Yes.
And then if they become a volunteer, all of those trainings are all free for them?
Correct.
That's amazing.
Yeah.
All right, maybe
Yes.
I'll join.
Yeah, there you go.
There we go. All right, well, is there anything that you definitely want to reiterate or make sure that people are aware of before we head out?
Ultimately, I think that just knowing that we're there, and if people have any questions about the health and wellness in the community or a nuisance complaint that they may have about something in the community, call us. Our number will be available, I would imagine, on the screen,
Absolutely.
so we'll just go with that. But
Absolutely.
we could help triage a lot of complaints.
Right.
And I think that we know town government, and when people call us on something, we're able to help. If it's not our office, we know who to call.
Absolutely.
And we could usually get satisfied people at that point, so that's our ultimate goal.
Wonderful. Well, thank you so much for coming on today, and enjoy the rest of your evening.
Thank you.
All right. Once again, I'm Stacey Hoppus, and I'll see you around town.